Hello everyone, Shaksid and myself are going to be talking about patient management for congestive heart failure. Introduction. What is congestive heart failure? Congestive heart failure is a condition in which the heart is unable to pump enough blood to meet the body's needs. This can cause blood and fluid to back up into the lungs and or their buildup on lower extremities, causing edema. CHF is a syndrome whose etiology is multifocal and is associated with comorbidities such as coronary artery disease, high blood pressure, and diabetes. Clinical oral signs and symptoms. There aren't many or unique oral manifestations of congestive heart failure for the most part. Patients with severe CHF may present with grayish blue mucous membranes, cyanotic lips, and or ashen gray appearance of the perioral skin. Other manifestations such as xerostomia can occur as a result of medication used to treat CHF. Signs and symptoms. Shortness of breath, fatigue, edema of the extremities and or veins in the neck, and frequent urination. Cough may be a sign of acute pulmonary edema. Treatment. The goal of all treatment for CHF is treating the condition's underlying cause, reducing symptoms, stopping the progression of the disease, may include lifestyle changes such as physical and diet and medicines. In severe cases, medical procedures or surgery may be needed.
Some common medications used to treat congestive heart failure include ACE inhibitors, which reduce the blood pressure and strain on the heart, and has effects on dental treatment such as orthostatic hypotension or an ACE inhibitor cough, which can interfere with longer dental procedures. Another commonly used medication are aldosterone antagonists, which trigger the body to remove excess sodium, but these have no effects on dental treatment. Third, we have digoxin, which strengthens the cardiac output, and its effects on dental treatment may include a sensitive gag reflex. The asterisks here just mean that the adverse effects or effects on dental treatment vary depending on the specific type of drug that the patient is taking. Continuing with the types of medications that are commonly used, we have diuretics, which reduce the pulmonary fluid buildup and swelling. Its effects on dental treatment, again, vary depending on the specific medication the patient is taking. Here, our adverse effects would be an increased frequency of urination. The last most commonly used form of medication used to treat congestive heart failure includes isosorbide dinitrate and hydralazine hydrochloride, which is used to relax the blood vessels and ease heart strain. The effects on dental treatment for this drug would include xerostomia and changes in salivation, and adverse effects may include dizziness and headache.
Patient management. Take necessary precautions to prevent a medical emergency and alert healthcare personnel about CHF condition and their role. The following are grounds for consultation/referrals. If the patient uses any anticoagulant, antiplatelet medication, make sure to have the INR values. Hypertensive patient, whether they're in stage 2 or in hypertensive crisis, a diabetic patient which has an HbA1c of above 10%, any artificial valves, history of infective endocarditis, and specific congenital heart conditions such as unrepaired or incompletely repaired cyanotic congenital heart disease, patients with history of angina pectoris or myocardial infarction. Okay, this is question number 1. What are some appointment modifications to consider for a patient with CHF?
Secondly, what precautions should a clinician take when using local anesthesia? Take some time to consider these questions as we move forward. Returning to our patient management focus, you want to evaluate patient anxiety and commence stress reduction measurements if needed. This may mean a shorter appointment or an earlier one as well. CHF patients taking certain medications are prone to nausea and vomiting during dental procedures, so you want to take precaution with procedures that can induce gagging like dental impressions, radiographs, or the use of a rubber dam. Additionally, use caution when using anesthesia with vasoconstrictors. Do not exceed 2 carpools containing 1.8 ml of anesthetic with epinephrine ratio 1 to 100,000. Additionally, appointment modification should include positioning the patient in a semi-supine position to facilitate breathing, limit the use of an ultrasonic instrumentation, use high-speed suction to avoid necessary fluid accumulation in the throat. This will minimize patient anxiety and breathing.